This is my intranasal medication administration video. So first thing, MAR versus the doctor's orders. We want to make sure it's transcribed properly. So we'll do name, John Smith, October 21st, 81, October 81st, 81. The correct medication, so Otrivin. Make sure everything was transcribed properly. Okay, then we can go ahead and do our 5 writes and our 3 checks. So I'll go ahead and get our drug from the medication drawer. So here we are. And then we're just going to do our first check. So Otrivin nasal spray, 1 spray per nostril, 1 spray per nostril. John Smith, nasal passages, nasal, ADM. All right, we want to make sure we're checking the expiry date as we go. Okay, good till next year. We'll do our second med check as we prepare the medication, but it's good to go like this. So Otrivin nasal spray, 1 spray per nostril, 1 spray per nostril. John Smith, nasal, ADM. And then we can do our third med check as we're preparing our tray here. So tissues to help clear nasal passages. And then we can do one more check. So Otrivin nasal spray, 1 spray per nostril, 1 spray per nostril. John Smith, nasal, ADM. All right, so done our checks. Good to go to the patient's room. So we go into our patient's room. We're gonna introduce ourselves. Hello, my name is Monique. I'll be your nurse this morning. We're gonna provide privacy. We're gonna be closing all the curtains. Make sure doors are closed. They're comfortable. Okay. I'm gonna go ahead and perform hand hygiene. So wash thoroughly in between fingers, gloves. Okay. So can I get your full name and date of birth? Okay, and we're gonna compare all this information to the MAR. So John Smith, I'm gonna be looking at his bracelet. John Smith, October 21st, 81. Okay, October 21st, 81. We have the right patient. Mr. Smith, I see you have an allergy to codeine. Is there any other allergies we should be aware of? No. We could also make sure there's no prior conditions that contradict the medication, such as hypertension or diabetes. We can go over our additional rights with the patient now. So, Mr. Smith, the right reason. This nasal spray is temporary relief of congestion due to excessive mucus by constricting nasal blood vessels. Okay. So right education, Mr. Smith, there may be a temporary burning, stinging, or dryness of the nose. Runny nose or sneezing may occur. And then we want Mr. Smith to know he always has the right to refuse the medication if he chooses. So first things first, we'll put our rails down, bed at a good comfortable position. For me, we're just going to have the patient maybe like that 75-80 degree angle, so just slightly lean back. Okay, we're gonna encourage the patient to blow the nose best they can, just so that the spray is not impeded by any sort of mucus and can be absorbed properly through the membrane. So I'll get him to do that. We'll dispose of that properly. And then we're gonna go ahead, we've got our medication here. And my opinion, or like I would assume you would encourage the patient to do it on, if they're able to, and if they're being assessed that they can do it themselves, or I will assist them. You're gonna gently put the tip of the nasal spray up into the nostril. You start with the closest side first, 1 spray, and then to the next, okay? So now we need to instruct our patients that they cannot blow their nose after, just to make sure all that medication stays in the nasal passages. We can provide them with some more tissues just in case there's a bit of leakage or drainage. We want to make sure they're comfortable. If they need anything else, do they know where the call bell is? You know, do they need to be repositioned? We're going to put our handrails back up, position the bed again. And we're going to take everything with us as we leave. After we know they're all comfortable, we're going to dispose of all our garbage, medication, our gloves. We're going to perform hand hygiene again. Okay, so then it comes down to our right documentation. So I've got my MAR here. and a pen. So we'll find Otrivin nasal spray EDM, the 16th, the date, obviously. We're going to sign and date it. Right evaluation. Was the medication administered properly? Yes, definitely. Was there any adverse reaction? No. Seemed to go just fine. And we'll just swing back around every, in 5 to 10 minutes, make sure the patient's doing okay and there's nothing irritating him too much or he's comfortable.